44 million people are living in Kenya. Only 4 million of them in Nairobi. Of all doctors in Kenya, 80% is working in or around the capital city to serve these 4 million. But what kind of doctors can give adequate healthcare to the other 40 million? Family medicine is a specialism that gives a master training for medical officers.
There's been a dramatic change in Iten Hospital in regard to the services they offer. Visit then and visit Iten right now, you'll get very nice services, unlike before. Not just the services being offered by the say nurses, doctors, but even that watchman at the gate.
So, do you know that the Iten Hospital has been run by family doctors some years now? And do you know what a family doctor is?
Honestly speaking, madam, I don't know what a family doctor is.
Professor Otsula sees the importance of family medicine. He is one of the founders of the first training in Moi University, Eldoret.
Family medicine, it's a specialty, but in a generalist form. It's a 4-year training, which equips the doctors with a wide range of skills to be able to deal with many conditions that affect the health of the people.
Professor Otsula is a cardiothoracic surgeon. He experienced what a family physician, a generalist, means in a health system.
I lived and worked in England, and I didn't go to the hospital before I was seen by my family physician. And I thought that worked well, because there was one person who knew the families, who knew everybody's illness, and who are able to refer the patient and get the patient back and continue to care for them. And I think that way you have a better care for the entire population.
The government of Kenya has accepted the role of family medicine in the healthcare system.
We require doctors to manage the common problems in the rural areas. Somebody who have done family medicine will be able to handle medical problem, will be able to handle pediatric problem, will be able to handle obstetric emergency, will be able to handle surgical emergencies.
The main focus in family medicine training and what we tend to look for when we interview candidates for family medicine is an individual who is driven by need to care, health equity, and is compassionate about giving care to mostly the people who are not paying for it. A skilled clinician who is driven by the need of the patient and who we would want to work within a community.
I'm Dino Suleiman. I'm 27 years old from Mombasa, Kenya. I'm here to find out more about family medicine. It's a specialty I'm really considering to specialize in. I'm a junior MO and I have 2 years of work experience. I'm going to meet Dr. Kanake. He's a first-year family medicine registrar. I think he's the best person to tell me about his motivations and why he chose family medicine. Since we are much on the same level profession-wise, I think he's the best person to talk to. I'm looking for Dr. Kanake.
Yeah. I'm Dr. Kanake.
Oh, hi, yeah. I'm Dino. How did you come upon family medicine?
So I met a family physician. The way he was working, I think was very attractive to me. Immense abilities on almost every field. So you'd call him whenever you had difficulties in medicine, whenever you have difficulties in theater, doing a CS or something. He was also quite competitive in surgery.
So he was an all-rounder.
So he was an all-rounder, and I really wanted to become that. That's what was my passion, to really be able to do all that for the patient.
Why is it that this specialized generalist will play an important role in the health system of Kenya?
Family medicine is very important because we are in a third world country, and third world countries are primarily because from people who are very poor and therefore need basic care. Now, family medicine is about providing good quality primary health care, and that is the foundation of any healthcare system.
If we are going to have universal health care in this country, primary care must be the foundation for health service delivery for our country. So for me, the values that healthcare should stand for is to have the right outcomes, which are the 9 areas. That care is accessible, is of good quality, it is safe, it's cost effective, it's efficient, it covers everyone, it is ethical and has a rights-based approach, it is sustainable. Those should be the drivers for every investments in the health sector. And family medicine is driven by the 9 principles, and it gives absolute satisfaction to any health provider, who is determined to make a difference for the people we are supposed to be working for.
This girl called Mildred came yesterday with conversions that were unremitting, something we call status epilepticus. We had wanted to give phenytoin, which was not available. We sent the mother to buy the phenytoin. The other option would have been to refer the child, and that would have been difficult because the parents were not able to raise the money enough for that purpose. If the family doctor was not available, probably the patient would be referred to the next bigger hospital, and the transit time and the transport would have consumed valuable time and probably worsened the outcome for this child. And now the girl is able to talk and take something by mouth with no problem, and we are very pleased.
A lot of people are thinking that a family physician is almost the same as a medical officer. Both are generalists. So, why do we need family doctors if we can have cheap MOs?
Kenya needs family doctors because traditionally what has happened in medical training is our students are taught in blocks of the main specialties. Unfortunately, the majority of these graduates cannot be absorbed into further training, and they end up continuing to practice as registered medical officers with the basic knowledge that they had at the medical school. And this puts them at a huge disadvantage to be generalists with not so much training that focuses on generalism. They went through small blocks of specialist training as medical students and even as medical officer interns. So family medicine comes in to bring this together, and in Kenya we are going to make a significant improvement in healthcare and especially the quality of generalist practice.
By the time you're getting a patient with a stroke, for example, it's a bit too late to do anything for these patients. They're already paralyzed on one half of their body, and they're going to be dependent on somebody or support from their family for the rest of their lives. Now, that patient started off with elevated blood pressure. It's very easy to check somebody's blood pressure. Now, we don't have enough trained clinicians in primary care. So if you don't have people who are adequately trained to detect these diseases as they begin to manifest, then by the time you're getting a patient with a stroke, can you imagine the cost on the healthcare system, the cost on the family? It's cheaper to manage blood pressure when it begins by diet and exercise and very simple things and changing one's lifestyle than it is to try and rehabilitate a stroke patient. So when you look at it that way, then you can understand why we need family physicians.
Dr. Dino meets Dr. Akaruka, who is one of the first family doctors in this country. He has been working for 6 years as a family physician.
Fine, how are you?
I'm fine.
Okay, yes.
So in essence, after graduating, you are considered a consultant?
Yes, you are a specialist, as per the definition of a specialist, recognized by the board. Yes.
So you are paid as a consultant. You earn more than an MO?
Definitely, definitely. You earn more when you are hired. For example, when I was an MO, you know about the Kenyan system. I was employed in Job Group N.
Okay.
I was a senior MO at Job Group N. When I finished, I was employed at Job Group P, and later on was promoted to Job Group Q. And as you know, in Kenya, you cannot move to Job Group P if you are not a recognized specialist.
Okay.
Yes.
As a family physician, is it possible to open a private clinic?
Oh yeah, why not? In fact, you are better placed to run a private practice when you are a family physician, because 90% of the problems are seen by family physicians, and you can be able to address them. So in private practice, it is very possible, and there are some people who have gone into private practice.
Have you gone into private practice yourself?
No, I am a lecturer now.
I work at the Webuye County Hospital as a family physician, and at the same time I do part-time private practice at Sunrise Medical Center within Webuye town. I will listen to your chest. Yeah, so let's first start with the neck. I see the general patients as a family physician. We see pediatrics, the children, the adults. We also sort out some surgical conditions which are outpatient in nature, and a number of maternal conditions as well as community health issues. Yeah, so I see all those as they may arise, at least most of them, but the few that I may not be able to see, I refer to the other specialists. So work together with my colleagues at the county hospital. So that now you end up now with these protrusions over there. We call them osteophytes. My practice is part-time, and there are some rules which are set by the Medical Board of Kenya. We do this mainly during the off hours. So during the weekends and during the weekdays at the times that we are off duty. So those are the rules by the Medical Board, and that's what we do.
You've been practicing as a family physician for 6 years.
Yes.
Have you had any opposition from any of the other specialities out there, or is your specialty a welcome thing in the medical field?
A lot of people do not understand how you can be a specialist, yet you are a generalist. Generalist in the sense that you see everybody. People tend to draw patients to themselves and say, this is my patient, and more so because they are looking at how much will the patient pay, how much will I get from doing this operation on this patient. And so if you find there's somebody who wants to come in and he's claiming he can do all that, obviously that broods resistance, because we go to theater, we do cesarean sections that are supposed to be done by obstetricians. We see children, and that is the field of obstetricians. We see adult patients who have problems, and that is the field of internal medicine. And we also do some other general surgeries. So you can see that if it's about this patient belongs to a certain specialty, then we cut across, and that in a competitive world is probably not a welcome idea.
Okay,
yes.
You do admit that family medicine has its limitations.
Yes, although you don't choose your patients, but in terms of seeing an undifferentiated patient, I would prefer that you see a family physician first, because then they are able to at least sort out a majority of the condition, up to 90% of the conditions that patients present with. Like we see gynecological patients, but now if you tell me that now I need to go and do repair VVFs, I don't do that, but I can diagnose and now refer the patient appropriately to the other specialists.
So, jaribu kuinua hii. The role of the family physician in the casualty or the emergency department is to see the patient on the first contact. So the diagnosis is made at the casualty before they get into the wards. So the family physician sees the patient at admission, makes the diagnosis, and now filters them into the wards or into surgery. Hii picha umepigwa leo? Okay. With family physicians running the casualty department, the number of unnecessary admissions basically are reduced. So basically the wards are also, people can be managed in outpatient. The number of misdiagnoses is reduced so that people are not treated for a wrong diagnosis with less complications now. The result is that the people are correctly diagnosed early, complications are limited, and basically it helps in the health service delivery. Nyingine nafungua inaona? Okay. Na nikifungua hiyo pia inaona?
There is actually room for everybody. You'll always get people who want to see a gynecologist. You'll see another one who want to see a surgeon, and another one to see internal medicine. But there's still very many other Kenyans who have no choice, and this is where the family medicine people are needed. The poor who need emergency care and who need people who have those skills, these are the people.
We wanted to improve the health of our people. The only way we can be able to reduce disease burden is engaging family physicians, because they can be able to go to the community, they can be able to talk to the families, they can be able to talk to the entire society within the community. That way we can be able to reach more people within a very short time. And that's why we want to embrace it, because health of our people will be able to be improved, and will reduce the disease burden within the communities. We'll also reduce the cost of treatment within the hospitals where they are working, because they'll be advising communities and they'll be training them, and they'll be so prevention will be on the higher side. More of people will have known how to prevent diseases within their communities and within their households than those ones who will be coming to the hospitals for treatment.
It seems that family medicine is a speciality for the rural areas, but as we can see in Nairobi, the family doctor is also working in big cities.
I feel the need for a family physician is to cover both a rural-based facility as well as offer primary care in an urban setting. Typically, you'll find that we have 2 shifts in the clinic. We have a morning shift and an afternoon shift, and in each shift there are 3 doctors manning the clinic, and patients are booked to a particular doctor so that you can have continuity. So if you see me, for example, the next visit, the next scheduled visit, you'll come back and see the same doctor. That affords continuity and opportunities for health promotion and coordinated care.
What I want us to do is to take a deep breath and hold that breath and then blow through this as hard and as fast as possible. So it's a deep breath in. I've held my breath and then I blow out. At once.
This is the center where all wellness checks are done and health promotion activities done in the hospital. We also have a lot of our patients coming in for chronic disease care, hypertension, diabetes, asthma.
Okay, that's not as good as the first time.
Before, you'll find that somebody will come into the Aga Khan hospital and be seen by 3 or 4 specialists. But by doing this in a more coordinated, cost-effective way, it saves them on money and they get appropriate referrals. So already patients give us good feedback that the care is more coordinated and more cost-effective.
Chronic diseases are an increasing problem in Kenya. There is an important role for the family doctor in this field.
As a family doctor, I work in the chronic care department. In the chronic care department, what we do is we follow up our patients who are on long-term follow-up. These are mostly diabetic people who have been diagnosed. So that's what we do in our chronic care department.
Dr. Dino is meeting Dr. Joy. She has almost finished her family medicine training. So she knows what you learn and what they teach to help you to become a good family doctor.
Hi.
Dr. Joy.
Yes.
I'm Dino.
Nice meeting you.
Nice meeting you. You had agreed to meet me.
Yes.
And tell me more about your training.
Welcome.
As a family physician.
Thank you. Karibu. We are doing our ward rounds.
Okay.
So this is a patient we have who has renal failure. Okay. And on a daily basis, we do ward rounds. If you're joining in your first year, it's basically to revise what you did in your med school years, to try and remember in terms of the medicine department, the department of pediatrics, going through the clinicals, going through doing your ward rounds, and then also outpatient care and the casualty care. But that's basically the first year, trying to go through what you learned, history taking.
Another aspect which is important in the family medicine curriculum is research. During the training, you need to make a thesis.
During this period, they're expected to write a research proposal and get it approved by the Moi University ethics body. And this is a condition for them to qualify to sit for the Part 1 exams. We do place very heavy emphasis on formative assessment evaluation. It forms 50% of the expectation of the grade for them to pass at the end of the first part of the training.
I believe that we need research done by Africans for Africans. And this is because we have heavily relied on westernized data, which is not applicable to the African population. Our diseases may be related, but the way our bodies interact very different. So we need data for Africans by Africans. And I'm passionate about getting first authors who are African family physicians, and predominantly in primary care.
Now, when we come into Part 2, we have the special courses, which one is the clinician. As a teacher, you're expected to be capable of teaching not only the interns as we used to do as MOs, but now at a higher level, you're like a mini consultant in your Part 2 session. Then there's the part where we do community-oriented, patient-centered care, where we go into the community. Like now, this patient we have seen, he's an elderly patient who may be in need, when on assessment, needs further care. We need to know why he has gotten to this phase, who has caretakers back at home, and the community understands his condition so that he doesn't keep coming back. I forgot one thing. We also have palliative care. Like this patient is a patient who would need palliative care as a terminal care patient. Palliative care is not offered in other courses, but one special thing with family medicine is palliative care is also offered, and that makes us at a different level. Habari ya leo? Salimia. Ukoaje leo? Hii maji. Unataka kupata chai? He had severe malaria.
Okay.
He's on quinine.
Is he jaundice?
Yes, he had a jaundice. But it's clearing because yesterday it was more deep. But today he's still complaining of abdominal pain. So I would like to examine it and see. Kidogo niweze kukupima. Takufungua tu kidogo mpaka hapo, na leo naona uko smart. Walikuosha? Pumua. Pumua. Baba, kidogo nikuongeleshe. It's good to have partnership with the family, so that is why I want to talk with the father, and that's part of family medicine. You have to involve the family. Baba ananiambia ameshindwa na kukula mingi mara moja. Patie kidogo kwa siku, kwa sababu tumbo sio vile ili. No, are you joining family medicine?
No,
Have I convinced you enough?
Not yet.
So we are seeing this lady. Munasalimiana aje na Kimara kwetu? Chamuge? Missing. Habari ya leo? Mzuri? Sawa, pole. Sitakuongelesha sana. Acha nimuongeleshe msichana yako. Sawa. So, part of family medicine is communication skills.
Yeah, I see you've mastered that. Was it the same as an MO, or do you feel you have improved?
I have really improved. I learned a lot. We used to come and call the patients patient bed or patient with this and that. And I remember there's once when we were medical officers and the patient said, I am not jaundice. My name is so-and-so. So part of it is to be able to communicate with their patient based on their name, be able to be loud and clear. We also learn how to break bad news, to be able to talk and console their relatives and touching them. The fact that you put a hand on them makes them feel much better and much more appreciated that you're coming close to them, and that way they are able to open up.
Usiku umelala?
Analala.
Zaidi ama analala?
Lakini bado uko na vidonda kwa mdomo. Zinakufanya unashindwa na kukula. Sawa. Akiwa hapa hebu tukae hivi. I hope you'll join family medicine.
We'll see. Okay.
Thank you.
In conclusion, what I've come to find out is that family medicine is a very specialty in that it caters for a lot of people, from the young to the old. That is very appealing to me. And just because of that, I could actually seriously consider family medicine as a specialty I would want to do in the future.
As a county of Elgeyo Marakwet, we still require more family physicians, because a family physician is also an educator. He educates the communities. So we will want to improve the program. We will want to have more doctors. We have already talked to the team that they are doing internship, that anybody who is interested in family medicine, we can see how the county government of Elgeyo Marakwet can be able to support a few that are willing to go for family medicine and come back to the county and work and support the people.
Kenya needs family physicians because they are ideal for the population. They'll be able to look after the majority of the people in the country effectively, knowing that they are trained to look after the entire family. A few things have been shown clearly. One, and it's a WHO recommendation, that to make healthcare as cost-effective as possible, the majority of the doctors in any nation should be family physicians. I think that the future for family medicine is bright. And I think that as we get more, people will become more aware, and more young doctors will come into this specialty. So I see them having a major role in the healthcare as it is.
At the moment, there are 5 universities that offer a family medicine training. Moi University in Eldoret, Maseno University near Kisumu, Kabarak University near Nakuru, Kenyatta University in Nairobi, and the Aga Khan University, also in Nairobi.